Hello?
Вера, у меня все скачалось.
Нормально, да?
Сейчас я быстро видео проверю.
Давайте.
Да.
Угу.
Окей, только я боюсь, что я теперь... Что надо сделать, чтобы звук был?
Значит, когда вы включаете демонстрацию экрана, надо внизу вот этого окошка поставить 2 галочки.
Share screen я делаю. Share sound.
Да, да, да. Видите, да?
Окей, да. Вижу, да. А мне нужно потом сделать, да, share screen?
Да, потом, не сейчас. Окей. Ну что, начинаем?
Да.
So, dear friends, dear colleagues, welcome to the Russian Innovation Night. We begin our innovative evening on the virtual platform of the Russian House Brussels, Europe. Добрый вечер, дорогие друзья. Начинаем наш выпуск Russian Innovation Night на виртуальной площадке Русского дома в Брюсселе. Our Russian Innovation Night will be done in English, but if you have questions or you want to make comments in other languages, in Russian, in French, you can do it. I will translate with pleasure. And today we have a very special topic to our event because it will touch a absolutely dramatic and interesting problem, the exoskeleton. And I am glad to introduce to you Ekaterina Berezi, CEO and founder of the ExoAtlet company, a Russian innovation company. You are located in Moscow in Russia, but also you have another location. You work in Luxembourg, so you're quite close to Brussels. And I'm very glad that we can introduce you and welcome you here on our virtual platform. So, Ekaterina, please, I would like to give you the floor for introducing your product and your mission and your vision of the resolving such a hard and important problem as the helping the patients with paralysis and movement disorders.
Vera, thank you so much. Here, so let me introduce myself. I'm Kate Berezi. I'm co-founder of ExoAtlet and the CEO of the global company. So right now I will share my screen to share with you the presentation. So I'm sorry, I suppose that to share once again. Like this, okay. Yes. Vera, could you see my screen? Because everyone is muted, so I'm not sure that it's
Katya, it's okay, you can share it.
Yeah, okay. Yeah, so ExoAtlet. So ExoAtlet team right now is based in different countries. So we have a head office in Luxembourg. So we have an R&D office in Russia, the manufacturing side in South Korea. So the office in Japan and US. And we work like the complete cycle company engaged in the development, production, commercialization of the exoskeletons. So we provide the exoskeletons for rehabilitation and for workers. So you could see that we are almost in the most biggest countries, and we work in we are focused as for Asian market as for Europe and US market. So right now we have the rather great experience of sales and working with the patients. So it's more than 60 hospitals in Russia use the skeletons for rehabilitation everyday trainings. So more than 20 in Asia region. And as we started only in the middle of 2020 in Europe, so it's the whole 4 hospitals in Europe. And the global concept of our business is the ecosystem, the rehabilitation ecosystem. So the idea is that the people who has lost the mobility could meet the technology of the rehabilitation with exoskeletons in hospital, but then they have to continue the rehabilitation. That's why we're going to build up the network of ExoRehabilitation centers, it's ExoGym centers, and to support them with ExoCloud collecting big data to provide to the medical doctors who start this rehabilitation with these patients in hospitals. So, and to teach them, we are building up the community, the medical community, and to collect all the experience of to collect all the methods and to share it. So an ExoEducation platform that is going to provide all these new trends and the scientific vision of our experts. So by statistics, so more than 6,000 patients has already undergone ExoRehabilitation. And if we calculate the number of the skeleton that works for these patients, it's more than 100 units. So it looks like that it's the big manufacturing amount that it's not already the startup. It's the company that we are the company who provides the mass manufacturing product. And because all our patient has passed more than 100,000 kilometers total distance. And we are very happy that we have the advisors. So a lot of our medical doctors works with us, and they provide us the new ideas how to improve their rehabilitation exoskeletons, as well as how to set up the new methods of the rehabilitation. So these advisors, they are from different countries, and they are working to set up and to conduct the clinical trials to publish the results, because the most important moment is to prove it's everyday job for us to prove the results of the exorehabilitation, like to perform the improvements of the patients. So just let me tell you some words about the skeleton, the exoskeleton, the ExoAtlet for adults. So, and the problem that we work on. So it's more than, it looks like it's 1 billion of people all around the world suffering from locomotion disorders. So let me just show you one of our pilots who used to work with us for some years. He's a disabled person. Walk on the flat. active life. So it was like the short demonstration of the.
I'm so sorry, Katya, we can't hear you over the video, please.
Oh,
so
you couldn't hear me.
we cannot hear you. So please make a pause during the video, yeah.
Oh, yeah, so funny. Oh, okay. So it was the short demonstration of their pilot, one of our pilots, who was injured during the car accident. And right now he has the great improvements because he had a lot of trainings with the skeleton. And as you could see by video, so the exoskeleton provides a lot of different movements and the possibility to work and to operate by itself, because we have this special smart crutch and the remote control that it's inside the crutch. And of course, let's go forward with the benefits for patients, because it's the kind of the most important thing that we could provide with our technology. So it's the motor function and the postural indicators. So from medical point of view, the measurements that the medical doctors do, it's the tolerance to physical activity. And they measure also the expanding, the range of daily activities, the normalizing blood pressure, and the postural indicators. But at the same time, the social integration, it's also very important. And it means that the people who use the ExoAtlet for everyday trainings or for trainings maybe 2 or 3 times a week, they could improve the quality of life and ensure their social stability. It means that they would like to continue to be the normal people and to get the jobs and maybe even to make the families and to make a birth to children. So it's very, very important moment to feel themselves that they are normal, they could walk and they could see the light in the end of the tunnel. And the device works for us very nice. So we work with the patients with the spinal cord injury, with the traumatic brain injury, with the multiple sclerosis, with the cerebral palsy, stroke, and arthroplasticity. So, and right now the ExoAtlet second, the second generation of our rehabilitation exoskeletons, it's CE mark certified. So we could use this ExoAtlet second in any hospital in Europe, and in some countries who accept the CE mark, like the medical standard for medical devices. It works very good for patients who has the 160 centimeters height up to 190 centimeters and the weight up to 100 kilos. So any person could use it because we have a lot of adjustments in ExoAtlets that could be adjusted to any anthropomorphic parameters. So what we could do, so what we could offer, so it's the normal walking, the walking up and down the stairs, so the turning on the same place, so they do steps on the spots, and different walking patterns. So the idea of the skeleton was to provide the most natural pattern of walking for anyone, because all of us, we are very, very different. We are walking in different ways, and we'd like to walk like it was before. That's why we should get the same pattern of walking to provide it to the patient, and we developed the different programs for it. One more thing that is very important and that is completely unique right now, it's the functional electrical stimulation. If you imagine how you do steps, so you will understand that the muscles are contracting, and they're contracting in special moments of the movements. So the functional electrical stimulation provides the contracting of the muscle together with the steps and at the right phase of the movement. So we like redesign the walking due to the functional due to every step. So and it's the kind of the miracle because the body starts to feel like the body does it by itself, and it's very important. And the results of this kind of trainings with functional electrical stimulation, it's very good. So it's almost unique. So and this guy, I will keep silence when the movie goes on. So this guy, he could even recover his locomotion function because he had the trainings with.
After training in the exoskeleton, I can stand with support, but I want to move again. So I started training again, but with more effort. The exoskeleton has inspired me.
So,
and after training in the
so this guy, he could not do steps before. And from my point of view, it's the miracle when the patient who used to be the wheelchair user for many years starts to walk again by himself, even if the steps are not so natural yet, but it's only the beginning of his training. So I believe and I really want that everyone could proceed with their rehabilitation and start to walk by themselves without exoskeletons, because we don't want to make people be keyboards. We want them to be the normal people. And there is the Cybathlon. I'm sure that you know about this competition that goes every 4 years in Zurich. And this is the kind of the competition where the disabled people should make a race with their obstacles, with the very different obstacles, and using the exoskeleton. So just let me show you how it works. Oops, no. And could you hear me right now? Yeah, okay, perfect. Because I will do the comments because it's much more interesting to see with the comments. So it's the very specific things that the patient has to perform. So you could see right now that he makes like a snake race. He could keep the balance by himself. Nobody could touch him. Nobody could support him. So he has to do everything by himself. And at the beginning, he performed how he could sit down and stand up by himself without any help. And he could keep his body vertically and do some operations on the table. And right now, it's one of the from my point of view, it's terrific to walk on not so flat. It's not flat surface, and he has to keep the balance, not to fall down, and he could operate him only with their remote control that it's included to their crutch by his right hand. You see how he switched the different programs and how he does walking. So this is the completely paralyzed patient. So he can't move with the legs by himself, so he even can't feel the legs. He passed through the specific assessment to prove that he is the paraplegic. And right now he is going up to the stairs. And this is their very interesting moment. So when he does steps up, keeping himself and trying not to fall down, you see a lot of people trying to catch him if something happens, but everything was okay. So he reached the top of their scale. So yes, here it is. So going up, it's not so terrific, but the most strange things is to go to stepping down the stair, because it's from the physiological point of view, it's very difficult to do this kind of steps and to keep balance by himself. That's why he decided to do it backwards. But we presented this year, the last year, 2020, we presented 2 teams with the ExoAtlet. The second one was our Korean team. And the Korean guy, he made the steps forward. So he made it like the normal people going down the stairs. But Yuri decided to do this backwards because it's more safety for him. And of course, it's very important the time that he passed all this race. Okay, so this is the last step for him. So once when we presented the ExoAtlet to one of their governors, he looked to us and told why he does so strange steps, why he doesn't walk like a normal person. Yeah, because it's very difficult to understand that the person that's inside, he can't do any movement by himself. That the all movements does by the exoskeleton. So the only movements that he can do by himself is just to turn with the shoulders. And right now you can see how he does steps with a very angled surface. And everyone around understands that it's very difficult to do this. So this is the competition of the pilots and of the technology at the same time, because they're on this year Cybertron, they were the other skeleton technologies, the other exoskeleton products who performed the same race. And we have done all their, we have passed all the obstacles. So it's the last one. So it's going up to their, by the angled surface. And this is an important moment because the ankle joint should be very flexible. So you can see he can stand on this angled surface like a normal person, and it's not so easy to do with the not so easy to design the exoskeleton to provide this very natural way of doing steps. The last moment he will open the door by himself. So idea of the Cybertron is to present that even the completely disabled person could do a lot of normal activities like that we need to do in everyday life. But of course, for us, it's the kind of the experience how to provide the most variety movements that normal person could do by the skeleton. Okay, he closed the door. And right now he has to go down, and that's it. Okay. Everyone is ready to get him if he decides to fall down. Yeah. So this is the finish line. Perfect. Okay, we could do applause to him. And let's go forward. So the second device that we developed, that we finished the development last year, is the ExoAtlet Bambini. So it's the skeleton for children. because we started the development of the exoskeleton first for adults, and then we continued for children, because the children, it's much more smart and difficult challenge to develop any kind of external robotic system that will provide them to the walking, the normal walking. So in the Bambini skeleton works for children that's from 4 years, 5 years old, and most of them it's with a cerebral palsy. So you could see here it's the real patient in the real hospital with a cerebral palsy. We made the kind of the research during our development of the skeleton. So we built up the 15 gait training sessions during this research, and the training sessions has been up to 60 minutes. So, and we have got so the goals and the objectives that we'd like to achieve. It's the quick rehabilitation for them, because it's even not the real rehabilitation, because these children never could walk by themselves. We have to teach them how to walk. It's not like to recover the locomotion function. It looks like to build it up, because the children with the cerebral palsy, they never could do the normal walking. So, and the idea is to provide them the skeleton that could reduce muscle tone, increase joint range, because usually the children with the cerebral palsy, they couldn't do the wide range of angles during the walking. So because of their muscle tones and because of their disorders, the neurological disorders, and the exoskeleton really helps them to start to do the normal walking and like to rebuild the way how they do the walking. So it means that improved gait pattern and improve the ability to carry on by themselves. So this is a short video. I can switch on here. It's you could see this lady, she made the side steps. So this is completely unique also. So because it's very important for training, so patients with a cerebral palsy to do any kind of the movements, even the side steps. So, and this is really first pilots of our Bambini exoskeletons. And we have the fantastic results with them. So they could even improve their cognitive function. So the children who could never do some kind of the drawings or writing, they started to do these movements of the fingers, because the locomotion function really improves the brain and the cognitive, and that they could do this. And one lady, she even started to pronounce any words. And after the training with the ExoAtlet Bambini, it was 5 or 6 trainings, she started to speak. And it was exactly during the training session, so everyone was really surprised. So it was the kind of what's going on. It's the miracle. But the problem is that the time, the periods that patients stay at the hospital, it's very short, and they want to be the normal people, they want to live at home, but they want to continue their rehabilitation. To get the exoskeletons for home use, it's very expensive. So this is really expensive technology, and it's not everyone who could get the skeleton for personal usage. That's why we decided to set up a network of centers for people with the locomotion disorders. We call it ExoGym. It's like the new type of training facilities that must be located near their homes, and provides, it's like the fitness for disabled people that they could visit every day, or they could visit three times a week, but regularly, and have the trainings with the skeleton, because it really helps them to improve their locomotion function. So it shouldn't be the very huge space. It could be 100 square meters up to 300 square meters. It can be anywhere on the first floor of the building, or in specific building in the parks, or it can be like their kind of, you know, where the normal shops stays in their apartment buildings, or even in a fitness center, because the fitness center has the space and their equipped space and staff who could provide this kind of the trainings. So it's can be even in a shopping mall, because it's very natural that the people could visit the shopping mall and do the trainings there. Why not? So this is the kind of dream, how to provide the ExoRehabilitation technology like a win-win for all, because the clinic gets more outcome-based rehabilitation results, because they have the non-stop, continuously rehabilitation process, because patients could have the parts of the rehabilitation in the hospital and then continue to do it in outpatient facility. So when we plan to set up the ExoGym like a franchisee model to set up them everywhere. So it was the story about the rehabilitation. But when we developed these products, the idea was to help people who has been injured or had a stroke or kind of disorders. But we started to think about, okay, what happens? How happens that so many people have disabilities? And some results is because of the spinal cord injury that they could get during their working on the manufacturing facilities. That's why we decided to set up the next generation of skeletons for normal people to keep their backs safety. So we call it ExoAtlet, and the name is torso because it could be put it on to the torso of the normal guy who has to carry heavies during his normal working process. So the ExoAtlet torso is a light, unpowered exoskeleton that helps that decrease around 40% of the spinal cord injuries. So it helps and utilizes their to decrease their loads for the spinal cord. And this is also very important that it's very light. It's around 3 and 9 kilograms. And it could compensate up to 15 kilos of the heavy. So it could be wear during the whole working day, and the person doesn't feel the weight of it. So it's very important for more comfortable working process and to keep more people safety than because they could get the injury. So we made the medical and biological experiments that proved that this kind of the passive, so the difference of the ExoAtlet and ExoAtlet is that the ExoAtlet is the passive device, so it doesn't cost so much. It could be implemented in any manufacturing facility, and it doesn't cost so much, so it's not so terrific if someone will destroy it because it's important for manufacturing site. So in this case, we had to prove that it really helps to carry heavies and to decrease the weight. So we made the kind of the case. So we made the kind of research that we measured all the parameters of the body, and we have got that their heart rate was lower with using the ExoAtlet, and their energy cost has been decreased up to 40%. It means that the efforts that the person has made, it's much less with the exoskeleton, with the ExoAtlet, that he does it in normal way without it. So it means that it really helps. And we believe in future, so we are the pioneers of the technology. There are not so many companies like we are, because we developed the technology that has to set up new markets, as in industrial field, as in the medical field, and the market opportunity is really great. So the experts, they're expecting the growth of the market up to 45% every year. And it's very understandable, because it's the 60 million people all over the world have lost their walking ability, and there are a lot of elderly people, and the number of them is growing as well, so that we could support them with the walking, and a lot of walkers for whom we could save their backs. So our mission is to save the humans and to give them a chance to be the normal people, and we believe in love. So, and thank you so much. So we believe in love to each other. We believe in love between medical staff to the patients, and we believe in love of their staff and their manufacturing owners. So we believe that our technology will bring their happiness to people, and the wealth for them as well, and the health, of course. Thank you so much.
Ekaterina Berezi is CEO of the ExoAtlet company. We believe in love as well, and all we need is love. Is absolutely sure. I agree with you, but some people need love, and exoskeleton as well. Thank you so much for producing it, for presenting it. Thank you for your mission. Thank you for your technology, for your products. Really, I remember very well when Ekaterina Berezi participated in one of the innovation forums in France, in Paris. I was there as well, and the pilot, the first guy of the first video you presented was there as well, and it was a big room, exhibition hall for innovation forum with a lot of people, etc. And I remember how the pilot of Exoskeleton began the demonstration, and in the moment it was silence. Everybody stopped the activities, and so all the people began to watch this miracle. It was really a miracle in the middle of a big innovation forum in the exhibition hall, and during 10 or 15 minutes when he make a round of the hall, the attention was absolutely occupied by this experience and unique demonstration of technology. It was really impressive, and I remember it very well. Your pilot, the first pilot of the exoskeleton, he's a very happy person, and he is a very positive person. He shared his experience with the spectators, and it was really impressive as well. So, Katerina, thank you so much. Now we have a lot of questions. We have questions sent us preliminary, and we have questions now. If you look in the bottom of your screen, you can see two questions made in Russian. I think that you can answer them yourself. Yes?
Yes. So the weight of the skeleton is around 20 kilos, but the exoskeleton stands all by itself. So the patient inside doesn't feel any weight of it, because the exoskeleton works by itself and stands on the earth by itself, on the surface. If the patient fell down coincidentally, no, he is not able to stand up by himself because he is paraplegic patient. So usually the patient should not fall down. That's why we strongly recommend, and it's the requirement to have someone who will support and who will provide the safety for the patient. So, and the second question is, yes, it's the upper very high level of the injury. Yeah, so the neck, for example, level of the injury. So usually we use the ExoAtlet for the neck level of the injury, but the patient are not able to operate by himself with the crutches, so he needs the kind of support, but he could walk with the ExoAtlet as well. So it works together it works for any level of injury. So we tried it, and we have the special doctors, medical doctors, who do this kind of rehabilitation for the patients.
Thank you so much, and I'll read another questions. Partially, you have also already answered to some of them, but it's always good to repeat the answer and repeat the information. Is the exoskeleton a passive rehabilitation device that controls movements for the patient? Can a patient who is capable to do so participate in the process? So could you?
Yeah, so the patient usually operates by himself, but we have the different modes of operating. So for example, we have the initiation of the movement. So if the patient could do some kind of movement, so we have some of the patients who is not completely paraplegic guys, but they could do the kind of movements, but it's not so nice. So we have the modes when he can do the kind of, he will try to do the movements, and the exoskeleton will help to do the step. So it's the different way of the walking. And of course we have the modes when the medical doctor could decrease the help of the skeleton. So it means that when the patient gets much more improvements of his walking, so when he doesn't need so great help with the skeleton, but he needs to be controlled by the skeleton, so it could be decreased, and he can do as much steps as he can by himself. So this is also a very important opportunity, and it's the completely different way of the control of the skeleton.
Okay, we have a comment of Mr. Ahmad Johara. from Syria.
Yeah, and
PhD research in robotic engineering. And if you want, we can make you make a comment, or should we read your comment? You see it?
Yeah, I see it.
Yeah.
So I know very well. So господин Poduraev, we work with them, and we even are going to set up the Exo Gym together with the medical university. It's their the project that we are going to start this year. I'm not familiar with the development that господин Poduraev has based on the exoskeleton for naval rehabilitation, but we know each other for many years, and he's a very nice person. So ExoRehab Spotlight, yes, ExoRehab Spotlight we made in 2019. We plan to make the ExoRehab Spotlight. It's the conference where we invite all the medical society who is interested in the new cutting-edge results of the ExoRehabilitation. We wanted to set up this symposium in Luxembourg in 2020, but due to COVID situation, it could not happen because all the events has been closed and or postponed. But I hope to see you on our next ExoRehab. You're very welcome. Thank you for your good luck.
Thank you for your answer. Is the exoskeleton certified as a medical device in Europe?
Yeah, it is. Yes, we have got the CE mark certification. So right now it could be used as their normal medical device in any hospital. There is a question, what are the achievable results? So we have many patients who has got through their spinal cord stimulation together with their walking with the ExoAtlet, who recovered the locomotion function, even if they could not work for many years before. So from my point of view, it's one of the most incredible and fantastic results that everyone should achieve. But sometimes it takes times and numbers of training, so it can't be done for 2 weeks. It could be done maybe for half of the year or even a year of regular trainings. But these results, we have them. And you could see the guy who can walk by himself right now with not so strong legs yet, but he can do it.
Thank you. What are the achievable results for patients with complete paralysis, excluding the improvement in vital health?
Answer, yeah, I've just answered for this question.
Yeah. Mm-hmm. Okay. How do ExoAtlet exoskeletons differ from their counterparts?
From what?
Nice question.
From their counterparts.
Yeah.
So
competitors.
Yeah, competitors, I suppose. So we have their functional electrical stimulation that none of them has. We have their proportional modes that helps to decrease the amount of help. So we have the ExoCloud that collects all the data and provides the achievable measurements as the results of the rehabilitation. So we have the much more quicker adjustment. So for medical doctors, it's very important that they could adjust during first 10 minutes, they could adjust the skeleton for a next patient because it takes time, and for them it's very important moment. And we have the most natural pattern of walking. So this is one of the most important things, that the patient who is inside the skeleton doesn't feel that he used the robotic technology. It looks like that he walks normally. That's it.
And for the battery, what kind of battery do you use in your skeleton?
So it's this special lithium battery that it's okay to use for the medical doctors for every day, for the full day of working. So they could start at the morning and finish at the evening, passing long way with, for example, 6 or 7 patients, and that's enough for them. So they could recharge it quickly if it's needed, but normally it's enough for the day life, and then it's necessary to charge it during the night, of course.
I have a question, me as well. I was very much impressed by your Bambini product. Yeah. It's really even more miracle than the product for adults. From what age could we, the person use it?
So right now it depends not on the age, it depends on the height. So it's 100 centimeters and 15. So it's the Bambini Midi. But we have the second product that it's ongoing development. It's for the smallest one. And I hope to present it in 2 years, this product.
So what kind of products do you have now for the smallest one till the biggest one? For different stages.
Yeah, it looks like that. So my daughter was 110 centimeters when she was 6, but she's the very small one. So I suppose that it's for children from 5 years old and up to their adults.
And we saw in your presentation there were 3 devices or 4 devices. Yeah. Different, yes? Yeah. So 3 or 4 different height.
Yeah, the different models of the exoskeletons for adults. So the Bambini, and right now we are working for other devices that it would be good for elderly people to support them when they need to continue the active life, to prolong their active life, and of course for the smallest children.
How many? You exist for a long time already. How many years of experience do you have of using your device already?
So we started the first experience in 2014. It was the first prototype that we made. Then in 2015, we started our clinical researchers, and in 2016, we started sales. And as we start sales and we have passed through the certification, we increased the number of the hospitals who started to be involved in the clinical researchers. So we have made more than 25 clinical researchers in different countries with the huge number of patients. It's around 400. So, and we have a lot of publications with the results of the rehabilitation. And one of the most important point that proves that this technology works is that the exoskeletons on Russian markets right now, it's included to the obligatory list of the equipment that must be set up in the hospitals. So it means, and it has been signed by the Ministry of the Health. So we're really proud that it was the results of our clinical research achievements that we proved that this technology must be the common way of the rehabilitation. That's why the skeletons are going to be in every hospital where they have the rehabilitation department. The same situation is in Japan. So in Japan, they have a lot of results with the exoskeleton as well. And they set it up, this technology, not only in the hospitals, but as outpatient rehabilitation standard as well. And also they provide the skeletons for the home using. So this is, the Japan is the country that is much far away from all other countries all over the world. But I believe that our efforts will meet all expectations, and the skeletons will help to millions of people.
Do you have already skeletons here in Belgium in the hospitals, or maybe for home using, and then Luxembourg as well, and in Benelux in general?
Yeah, we have made the presentation in the University of Gand and the hospitals in Liège, it's in Belgium, and in Luxembourg, in CHL. So the situation with the COVID really doesn't permit us to go as quick as we would like to set up these skeletons for everyday routine practice. But I believe that this year we will set it up for the rehabilitation. But we started the ExoGym pilot project here in Luxembourg. And yesterday we had the first pilot, the first patient, who
congratulations.
Yeah, who tried, because for us it's important that it's not only their in-hospital technology, but it's also the outpatient technology. Who is interested? So this patient, he is interested to continue the trainings on a regular basis, and I believe that in some period we will present the results, and it becomes not the pilot project, but the common way of the rehabilitation.
But we hope that you can come here in Brussels when the pandemic will finish, and present your product exoskeletons here in on the stage of our center, or we can organize some presentation for you here in Brussels, inviting people to make a visual demonstration. That's very impressive. As I said already, I know it. So you're always welcome after the end of pandemic.
Okay, thank you so much. I think that we should not wait the end of the situation that nobody could understand. So we can organize it as you are ready. So we can.
Yes. So we shall consider that today online evening meeting is the first part of your presentation, and the second part, the real one, will not be so far.
Thank you so much.
Today. So I think that we have done already a lot of information, interesting. We have answered the questions. I would like to thank everybody for his participation, her participation. And I'm very happy that Ekaterina Berezi is with us for today evening for Russian Innovation Night. And I wish you good luck to you, to all your products, to all your technologies, and for your mission as well. All we need is love, and we believe in love. And I'm absolutely sure that your mission will be the aim of all your life and all your professional activity. It's very, very, very important project. I think that it's one of the most important and hard heading for realization products and medical sphere. So thank you for your efforts and for your activity. And you are always welcome in the Russian House in Brussels, Europe. And we'll publish the video of today's meeting on YouTube channel of Russian House Brussels, Europe, so everybody can see this video later. And on the website of our Russian Center, Russian House, you can find the address and another coordinates of ExoAtlet company and Ekaterina Berezi. So you can address the ExoAtlet company later, and we can provide you the contact as well on your request. Ekaterina, thank you so much one more time. Maybe you can make a little conclusion for our spectators before saying goodbye.
Yeah, so as we are based in Luxembourg, interested, you're very welcome. So you can come. We are based in Technoport in Bilbao. So it's an Lux Innovation territory. So we would be very glad to present you the technology. And if you need if you have any questions or any requests, so please don't hesitate to send it to us, as we would like to reach the people who need it. And it's the rather new technology. That's why it's not so easy to step over the standard vision and standard way of thinking. So we are breaking the rules, providing
and change the game. You are game changers.
Exactly, providing the completely new way. And of course, we would like to get any kind of support if you would like to share it with us. So thank you so much. Yeah, and have a great weekend.
Thank you so much. Have a great weekend and think different as well.
Exactly. Yeah, thank you.
Thank you. Thank you, everybody, and good luck and good have a nice weekend. See you later on the virtual platform of Russian House, Brussels, Europe. Goodbye.
Bye. Thank you.